Today joined the world in marking the Mental Health Awareness Day with a rallying call to increase the capacity of healthcare professionals to deal with the increasing health challenges that is witnessed in the country. Mental health advocates across the country have urged for preventive approach over response in line with this year's theme of making mental health and well-being for all a global priority. Wycliffe Okech reports.
Prevention and response. Mental health care.
In efforts to curb the surge of mental health challenges, especially among uniformed officers, the Kenya Prison Service, in collaboration with the Kisumu County Government, has launched a program meant to create awareness about mental health. The multi-sectoral program seeks to address the challenges of mental health from the two facets of prevention and response.
This is just one of the programs which is running in Kisumu County. We have several other programs which are running, which will help us to prevent mental health and to be able to deal with mental health. Mental health is a big problem everywhere. I don't need to look at the statistics, but if you just look at the simple thing like domestic violence, Kisumu County has almost 10.4% rate of domestic violence. So you can see how high. That is 1 in every 10 people who are married have suffered from some domestic violence.
Mental health must be integrated into primary health care to ensure that we implement this program at the community level.
In a similar event in Laikipia County, stakeholders have called for deployment of more counselors to health facilities.
Just as we know the economy is not doing well, so we have so many of our people who want counseling, who would require psychiatric treatment, but they cannot afford it. But if the government gets engaged and starts having this kind of doctors in our hospitals, we believe our people will be assisted.
Meanwhile, in the capital Nairobi, the county government was challenged to prioritize mental health in its planning for the provision of primary health care services.
Unapata kijana ndio aweze access hizo counseling sessions. The cheapest session per hour is 3,500. So you can imagine kijana ana hata chakula, ana kazi, alafu ako na pressure, depression na bado anaitishwa like 4,000 for one session per hour.
Please reach out to any health facility because we have help for you. We want to eliminate the idea that people suffer until it's too late, until they're identified when they can no longer be helped. And this is something that is a big issue.
Finally, in Meru County, stakeholders call on the government to include mental health in the National Hospital Insurance Fund cover to enable low-income earning Kenyans access psychiatric services in times of need.
Tuko hapa kuuliza serikali ihakikishe kwamba NHIF program inaweza tumika kulipa the cost of treating some of these mental health, because the cost of treating is becoming very expensive for our youth in Kenya.
Leo kama siku ya World Mental Health Day, pia tuna encourage watu ama young people kuwa part of the solution, na tuna encourage pia watu pale kwa community, watu wa create safe spaces whereby young people can just come in and people talk about these issues that affect people.
For Prime Edition, I am Wycliffe Okech.